Exactly 1 month ago today, I got jaw surgery. I wanted to film a video talking about why I got jaw surgery, the process leading up to the jaw surgery, and then this first month of recovery. When I was going through the process, and still now watching videos on YouTube and reading Reddit posts were very helpful to me. So hopefully someone out there, if you're going through the same thing, this might be a little bit helpful for you. If you have any questions, please let me know in the comments. I'm more than happy to answer things that I don't talk about in this video. So let's start off with why I got jaw surgery. So technically my diagnosis was maxillary hypoplasia, meaning my upper jaw was not developed fully forward enough. It didn't grow enough. So how that impacted my bite was my teeth were edge to edge in the very front. So the top teeth and the bottom teeth were touching. Every time I bit or closed my mouth, those little tiny edges would always clash. And that causes chipping of the teeth, wearing down of the teeth, gum recession. It can cause difficulties eating. And additionally, this part of my bone in my skull was a little recessed, and it's the base of your nose and a lot of the nasal passages. It can impact your breathing negatively as well. So that was taken into consideration to improve my airways. This was a medical procedure covered by insurance, and it's something that I had an inkling I would have to do for over a decade now. The first consultation I got was probably when I was 18 years old, around that time period, and I was just getting into college, and I think even at the time they said that I'd have to have my jaw completely wired shut after surgery. So I basically just chickened out and swept it under the rug and ignored it for a very long time. But about a year ago, a little more than a year ago, I decided I was going to finally address this issue and get it fixed before I have kids, before I have any other major life events, and while I'm still pretty young, so that recovery is not hopefully so difficult. So the movements that the surgeons did for me in my case were fairly simple. It is to move my upper jaw forward about 1/2 centimeter. I think there were also a couple other changes, either rotating or changing the angle a little bit, but I don't remember all those minor details. For the most part, this was to just move it forward so that my teeth now are actually in front of my lower teeth in the front. So in the fall of 2023, that's when I started to get my consultations. Everyone said the same thing. I was actually turned down from a dentist who I originally thought that I would be able to just get Invisalign and pull a couple teeth, move some things around to fix my bite. And after he submitted everything to Invisalign and saw the plans, he basically said, you know, I don't feel comfortable doing this. You should see an orthodontist. And every orthodontist said the same thing. So after a couple months in denial, I did decide to go through with the whole thing, actually doing jaw surgery. But before jaw surgery, you typically need to get some orthodontic work prior to the jaw surgery. This can be a couple years if you've never had any braces and you have a lot of straightening to do. Now, I had braces when I was in middle school, but I haven't worn my retainers in probably 10 years, which is a big no-no. If you have retainers, stick with them. And definitely this time around, when I get these braces off, I will absolutely be wearing my retainers every single day. But my plan was to be in Invisalign for about 10 months. And that worked out fine. It was a little bit of an adjustment to change my diet a little bit and my eating habits, because you have to take them out every time you eat and brush and all of that. But I was pretty happy that I didn't have to have braces that entire time. Now, after I finished the Invisalign the end of October, I did actually get braces put on in the middle of November, and I didn't know originally when I started this journey that I would have to get braces, but my orthodontist convinced me that that was one of the least invasive and probably the best ways to go about the surgery, because the braces are basically used to help wire your jaw shut during the surgery, because there's a bunch of hooks that they put on the brackets and in between in the wires. And then also after surgery, those same hooks can be used for rubber bands to fine-tune and manipulate the bite during the healing process. If you don't do braces during the surgery, the alternative is to get screws, additional screws, put into your jaw that you put rubber bands and they use that to wire shut. But that's an additional 4 to 8 screws. They're called TADs, temporary anchorage devices, which is a little bit more invasive and additional holes in your mouth that maybe don't need to be there. So they're already cutting everything open and already putting so many screws and titanium plates to fix my jaw in the correct position that I decided anything less invasive that I could do, I was okay with that. Now, I did forget to mention around July of 2024, I did get my upper wisdom teeth removed because whichever jaw they work on, they also make some incisions where the wisdom teeth are, and they like to do the wisdom tooth removal about 6 months before the surgery, give it some time to heal, and then proceed with the surgery. Some people get their wisdom teeth removed during the surgery, but again, I preferred to do it earlier and let my body heal. So it's just a little less complex and risky on the day of surgery. Okay, so now we're at the day of my surgery, which was December 18th, 2024. I got to the hospital very early in the morning, around 5:30, and my scheduled operation time was 7:30 in the morning. My surgery went off fine without a hitch. I woke up, I think 2 hours later was the total surgery time. Although I don't remember immediately waking up. You're in this area where they very closely monitor you for a little while post-surgery. And eventually I woke up late morning, and the first thing I remember was my nose was really cold. I think because of the nasal decongestant that they used before putting the breathing tube through your nose into your, esophagus during general anesthesia. I think that decongestant just made the blood flow basically non-existent there. So it was just very cold, and I wanted some water to, drink down my throat to soothe my throat a little, because you will probably have a bit of irritation in your throat from the general anesthesia breathing tube that they have to put down. But other than that, I did not feel any pain when I woke up. I did not feel any nausea, which I was very nervous about because I was very scared to throw up with my jaw wired shut. Although my jaw was not wired shut, I just had rubber bands on the sides as I do now. But when I woke up, I didn't feel any pain. I just kind of fell back asleep for a couple hours, woke up, fell back asleep until most of that anesthesia was out of my system. And then I was moved to my inpatient hospital room. Now, originally, I wasn't supposed to stay in the hospital, but I did end up staying overnight because it got to be really difficult to breathe. The decongestant started to wear off, and because of all the swelling and irritation in your throat and a lot of the mucus and stuff that's going on, it was really hard for me to swallow and breathe. I was gagging a lot. So finally my nurse called my doctor and asked if I could use more medicine, more decongestant, and originally he didn't want me to before this episode in the evening, but because it was a matter of me breathing or not, he said yes, use more. So after I took more medicine, I was finally able to get a little bit of relief and rest, and I slept until the early morning. So the next morning, the doctors came in again. They looked at everything. They said I looked good, and they discharged me. So I went home. Now, the first week at home is pretty much just resting, taking a bunch of medications. It felt honestly like a part-time job, crushing all these pills that you have to take multiple times a day and drinking them because they're very bitter, especially the ones that you have to crush. And you're drinking copious amounts of Gatorade for each of these pills multiple intervals throughout the day. But that was pretty much all you had to do at that point. Now, day 3 and 4 were definitely the most swelling that I experienced. Pretty standard. Everyone says the same kind of thing. Still didn't feel much pain though, just pressure and maybe some headaches and a little bit discomfort in my throat. The main point of discomfort for this week though was the congestion in my nose. I have a very hard time breathing through my mouth, especially if I'm sleeping, because my throat gets very dry and I cough a lot. So I definitely used a decongestant when I slept at night. But finally, at the end of the first week, I think it was day 7, was the first day I was able to breathe through my nose a little bit without any nasal decongestant, which was such a relief. During this week, I was also pretty exclusively on a liquid diet. I was using those syringes that you see everyone using, and you just shove them in the back of your mouth and push whatever liquids you can eat down your throat, basically. It definitely got old after the end of the first week, but I saw my oral surgeon around that first week mark, and he did take out the rubber bands for me and said that going forward I could take them out myself for eating, brushing my teeth, and then put them back in afterward. So that was what I started to do during week 2, which was so nice to be able to actually brush my teeth, because up until that point I was just rinsing my teeth out and using a water pick on my lower teeth. But it definitely felt like I needed to scrub a little bit more. The swelling was also starting to go down a lot. Really after that 4th day is when you see a significant reduction in swelling, and then it kind of slows down a little bit week after week, but it'll still go down. I know now I'm still swollen. I don't know if you can tell, but the swelling is still quite a bit in my cheek and above my upper lip. But my lip is no longer swollen. I did also have some scabbing in the first few days around my lips because they have to stretch it out for the surgery, but that healed fairly quickly. And now I'm just left with a little bit of residual swelling that I think probably will take a couple more months to really go down. So about 2.5 weeks post-surgery, I went to my orthodontist and he changed some rubber bands on one side of my mouth. And I also didn't have to wear my front rubber band in the daytime. I only had to wear it at nighttime. There are some changes and things that he needs to make and we're still working on. My midline is a little bit off, but we're working on getting it more in line. And my bite on my right side is not as tight as it should be like it is on my left side. My left side's really good, but this side, it needs to be brought together a little bit more. So I wear rubber bands pretty much the entire day. I have a couple on this side and one on this side, and I just take them out when I eat and brush my teeth, but then I put them back in. I see my orthodontist again in about 5 days from now, so we'll see if he changes things up again. I don't think he's going to be able to make any changes to my wires, and I don't know the full timeline of my braces getting off, but I think that'll have to be around the 6-week mark, they said, until the initial bone is fully healed, until they can really start doing more orthodontic work to finish me up. But this last week has been pretty good. I've actually been going on long walks. I've been trying to get 10,000 steps a day, which is really great because before then I would get kind of out of breath and I was still feeling pretty weak from not eating so many calories that I could maybe just do like a mile, but now I can actually do longer distances. I'm experimenting more with eating a lot more foods, like I can do eggs, mashed potatoes, rice. I've even done some takeout rice dishes like fried rice or curry with rice in it. I just blend the vegetables in the curry a little bit, but I'm eating a lot more things than I was originally, so my weight is plateaued now. I've lost about 5 pounds throughout this process, which actually is not a lot based on what I see with other people's experiences, but I didn't have a ton of weight to lose anyway, and I'm kind of petite, so I feel like I can make up the calories that I need much easier than if I were, you know, a man 6'3" who requires many more calories just to stay at their regular body weight. But I've been feeling really good. I have energy. I sleep normally now. I'm back sleeping in my bed, laying down. I can even lay down on my side and everything is fine. Throughout the process, I haven't had too many complications. There was one unexpected complication, I guess. I don't know if it's a complication, but I did develop oral thrush around the 1 week, 1.5 week mark because of the antibiotics I was taking. So oral thrush is that white coating on your tongue, and it feels really uncomfortable to swallow. It's just your microbiome in your mouth is off because all the good bacteria is gone, and if you have a weakened immune system, which I do because I'm on another medication unrelated to jaw surgery, but it does suppress my immune system. So I did develop oral thrush. I would just say to try to prevent it, if you can spare the calories, don't drink so many sugary drinks. I was drinking a lot of sugar Gatorade to drink my medications. If I'd done the sugar-free, that probably would have prevented it a little bit because the yeast feeds on sugars. And also do a lot of saltwater gargles. Those helped a little bit, but I was able to reach out to my doctor pretty quickly, and within a day, the prescription mouthwash that he prescribed pretty much solved the issue, thankfully, because that was getting to be really uncomfortable to swallow, and it was very present all the time. As for nerve sensation, right now I can feel pretty much everything. I've gotten a lot of my nerve function back in my cheeks. This was where it was the worst, and it's still a little bit like a muted sensation, but I definitely do feel it now, which is a great thing. One weird thing, however, is that the top of my mouth, the palate, is still pretty much completely numb. You can feel your tongue on it, like, or my tongue can feel my palate, but if I touch my palate with just my finger, I don't feel anything, which is a little bizarre. But I have faith that some of that will come back over the next few months, and honestly, it doesn't really bother me that much. I do notice, though, that there's a little bit of asymmetry in the way that I can move my lip right now. Hopefully, after I get some of these hooks and brackets out and my incision heals, and I continue to, you know, practice talking and smiling and stretching out, that will kind of go back to normal a little bit. But for the most part, I do feel a lot more sensation than I did in the beginning. I never had any loss of sensation in my lower mouth or chin because I didn't have any manipulation to my mandible. So yeah, I'm pretty happy about that. But other than that, I've been doing pretty good. Here's what I look like now. If you notice my face is a little weird in the next few videos, that's why. This is my profile. There's definitely still a bit of swelling here that I can see, but I don't think, especially if I don't talk and I'm out in public, I don't think anyone would really know that I had jaw surgery when my mouth is shut. They probably just think this is the way that I look. But I'm really excited to see how my swelling goes down and everything heals in the next month or two. So I'll definitely keep you guys posted then. Once again, I really hope this was helpful. Please ask me questions if you have questions. I want to be a resource for other people, and one of the main reasons why I'm documenting this process, even though it's a very vulnerable thing to talk about, is I didn't see very many people get exclusively upper jaw surgery. Most people on YouTube were getting double jaw surgery. So if this is your case, then hopefully you can use this to get a little more information on what to expect if and when you do have this kind of procedure. Anyway, thank you for watching. If this was helpful, please give it a like, and hopefully you stick around for my next updates. Bye.